Hello, everyone, and welcome back to our part 2 on the lecture covering altitude and our pulmonary response. Last time we closed out by saying that hyperventilation increases our alveolar ventilation, and what happens because of that is that we see a drop in the partial pressure in CO2 of our alveoli, and then we see an increase in our partial pressure of O2. And so that's good because it helps recover some of that oxygen that we lose for going up into extreme altitudes. But today we're also going to talk about the effects of that hyperventilation, because not only can hyperventilation impact O2 and CO2 in our bodies, but it can also impact pH. And so what happens is when you are hyperventilating at high altitudes, it's going to result in maybe acute or chronic respiratory alkalosis, which is an increased pH. So we're saying here that hyperventilation is going to lead to less acidic blood or more basic blood. And the reason for this is because we are exhaling more CO2. And so you may be looking at CO2 and you're like, well, what does CO2 have to do with pH? Because pH is, measuring hydrogens, and there's no hydrogen within this formula. But remember that CO2 will combine with water to make carbonic acid, and then split to make this bicarbonate and hydrogen. So if you have less CO2 here, right, you're going to have less of this acids that are being formed. So CO2 a lot of times does act acidic in our bodies. And so when we are exhaling more, getting rid of more of this H2O and this CO2, as a result of that, we are going to have less hydrogens and less acid within the system. Therefore, that pH is going to increase and the blood becomes less acidic. And so CO2 acts as, partially, or an increase in CO2 will mean that the blood's more acidic, and while, that sort of aids in acidity, bicarbonate is actually the opposite. So bicarbonate is going to be our hydrogen buffer, because whenever we build up the level of bicarbonate, more hydrogens combine to bicarbonate, and then we get CO2 and H2O. So it all depends about what changes are going on in our body as far as what are our products and our reactants. And so what happens is when we hyperventilate, it causes us to have more alkalytic blood. And it also can occur in other areas, not only going up into altitude. That's why anesthesiologists go through so much training and are paid so much, because it's very important that you properly, administer anesthesia, so you don't have a person who passes away on the table due to changed breathing. And so also anxiety as well. If you go into a episode, you could start to hyperventilate, and this can change your pH, and so it could lead to altered function, and maybe you pass out, or there are negative consequences that can come about because of it. But at altitude, it's just a adaptation, right? So it's because we need to make up some of this oxygen at altitude that the hyperventilation is necessary, but this is going to be a byproduct. But our body figures out a way at altitude in order to correct this. And so that is called compensated respiratory alkalosis. So the compensation, so since we are decreasing our CO2 and that blood's becoming more basic, well, what our body basically signals is that we are then going to increase urinary excretion of bicarbonate. And so now we're getting rid of more of that buffer for those hydrogens. And if we get rid of more buffer, well, then more of these single hydrogens are going to be within the bloodstream. And more hydrogens in the bloodstream, less bound to that bicarbonate, that means the blood will return to be a little bit more acidic, and that'll help offset that change in pH due to hyperventilation. Another adaptation that comes from going into altitude is what's called polycythemia, or the addition or in the synthesis of red blood cells. So when an individual is subjected to low concentrations of oxygen for a prolonged period of time, this increases red blood cell production. And of course, we need to increase our hemoglobin. And so this is a strategy in order to basically combat the changes that are occurring at high altitude. So if you have more red blood cells, you have a higher oxygen binding capacity in the blood. So that's a way to partially try to increase that O2 content within the arterial blood. And so people who live, though, at high altitudes often have normal or above average O2 carrying capacity, even though they have low arterial oxygen or saturation of oxygen. The reason why their carrying capacity is so high is because they have red blood cells. And we're going to talk about in a little bit, how that translates to athletes and some of the recommendations and things that have been done in the past to try to take advantage of this. So we're also going to talk about some of the other responses that may occur at altitude if you have some underlying conditions that may affect your tolerance to altitudes. Respiratory acidosis can occur, and this is going to result from the fact that maybe you have a lung pathology, you have a disease like COPD where you're not able to take in large quantities of air. And so because of that hypoventilation that's occurring, right, then like we discussed on the last page, that would be the opposite. And so, if we hypoventilate at altitude, it can then result in that decrease in the bicarbonate CO2 ratio, and then also decrease pH or make the blood more acidic. We could also like the compensated respiratory alkalosis, that's going to result in metabolic, acidosis, trying to increase the acidity of the blood. But let's say you have a condition like uncontrolled diabetes, where you could have excessive excretion of bicarbonate. Well, if you decrease bicarbonate to low enough levels, acids will start to accumulate, and then you're going to have a lower pH. And then there's also metabolic alkalosis that can happen, which is an increase in bicarbonate pH, and that may result, if you lose a lot of acid, let's say like prolonged vomiting. And so, you combine any of these factors with altitude, it may make your exposure a whole lot worse. So I'm going to ask you right now to actually pause the video because we are going to take a look at another YouTube video here that revolves around Wim Hof, and so you may have seen him in the media before, but he's able to do some outstanding things when it comes to cold exposure and also like climbing feats and swimming under ice. It's very cool. I will say it gets a little bit sad towards the middle of the video, but I'm going to let you pause this right now, watch that video, and then we'll come back to the lecture and talk about it. I love bringing up that video during this lecture because it, basically covers the things that we were talking about and how big of a role even breathing is in our physiology, right? So the reason he's able to climb these mountains in shorts and swim under periods of ice for insane amount of time is because he's just changing his breathing. And so like we talked about, that changes the pH, that changes the CO2, that changes the O2 in our bodies. And when you're able to do that, some fantastic things can come about. So maybe, you exercise professionals one day in the future, maybe you'll be researching, different methodologies when it comes to breathing and the benefits of deep breathing and these different breathing methods, right? So really cool stuff. But let's continue here. So only a few more slides to go. We'll talk about first chemoreceptors. And so we have two main sets of chemoreceptors. One's called the central chemoreceptors and the other are called the peripheral chemoreceptors. So the central chemoreceptors are in the brain. And more specifically in the medulla. And so these central chemoreceptors, they're going to pick up on different chemicals within our blood, right? And so these central chemoreceptors pick up on CO2. Since CO2 readily diffuses across the blood-brain barrier, the reason we have that blood-brain barrier is to prevent certain hazardous materials or ions or chemicals from coming across and damaging our brain. But CO2 is able to diffuse, and so these central chemoreceptors are going to pick up on blood levels of CO2. And so they control the majority of resting ventilation, around 60 to 80% of the depth of our breathing, the rate that we're breathing, is going to come from the measurement of CO2. So it's really CO2 that drives our ventilation, right? So you would think, oh no, it's oxygen. That's what we're really picking up on, and to a certain extent, yes, absolutely. But it's really going to be measuring these levels of arterial CO2 that are then going to send levels to the brain. So when we go up into altitude, and that ratio of CO2 to O2 becomes greater in our lungs, well then there has to be that has to be picked up on by these chemoreceptors, and that's going to lead to increase in ventilation. So this way we can start to remove this CO2 and start to increase the pressure of oxygen within our lungs and in our blood. And then we have the peripheral chemoreceptors, which are in similar places as our baroreceptors, or arterial baroreceptors that we talked about, and that's in the aortic arch and the carotid bodies. Again, a good place to measure, what is going on in the blood, because it's coming straight out of that left ventricle. And so, they're going to receive a lot of blood flow, and not only are they going to pick up on changes in the partial pressure of CO2, but will also pick up on the pH levels and also partially O2 levels as well. And so they maintain around 20 to 40% of our ventilatory drive. And remember, these receptors, they are attached to sensory nerves that are going to carry this information to the brain, and then our brain basically processes it and figures out the action that we should take, whether we are reinforcing a behavior or trying to, for example, when we go into altitude, we're trying to increase our ventilation. So we may have to change something that's going on physiologically based on the environment within our blood. And so, when these chemoreceptors pick up on changes in CO2, pH, and PO2, send signals to the brain stem, the medulla, and then we are going to have a result that we increase our ventilation. But again, peripheral control about 40 max, so 20 to 40% of ventilatory drive. So the central chemoreceptors are the one that maintain a majority of the resting ventilation, and that means really, again, CO2 drives most of our resting ventilation as well. And so here you can see the changes. So normally our alveolar PO2, something around 100, or blood or arterial PO2 as well is right near that number. So here's going to be our resting ventilation, and our resting PCO2 levels right around 40 to 45 within that blood. And so if PO2 starts to decrease, you see you go from 100 to 90 to 80 to 70, even to 60. There's not much change here in ventilation, okay? And again, that's because it's really the central chemoreceptors, the ones that pick up on CO2, that drive this ventilation. So, we don't really see that increase in ventilation until PO2 oxygen levels get very, very low, right? So that's going to be once we get below 60 mmHg, that really drives up ventilation, right? But CO2, changes in CO2, even a slight change. So if we look here, roughly above 40, that partial pressure of CO2 increases to 50, right? Not too much more, only by, 10, less than 10. We are quadrupling ventilation, right? So it's really that regulation of CO2 that drives our hyperventilation. And here you see what is going on with the relationship between PCO2 and then ventilation. So this is how it is normally, and then what's going to happen is, once we become hypoxic, we're a lot more sensitive, and we're going to have that increase in ventilation, with that reduced PO2. And then, we also have effects. Sedatives, for example, can have an effect on that breathing response. And so we said about anesthesia earlier, but any sedative will really depress ventilation. So here we see it's not only altitude that affects breathing, and that can alter chemicals, it's other drugs and related things as well. All right, so since we are at altitude, we're breathing in more air, we have that hyperventilation going on. We remember that ventilation and perfusion relationship from previous lectures, and so we want that relationship to be 1-to-1. So if we increase our ventilation, we got to increase the amount of blood passing through. And so that cardiac output is going to increase, both during rest and during exercise. And that's going to help increase that oxygen delivery to cells. But a lot of times, when you become acclimated, you don't see that same increase in cardiac output. And a potential theory to why that is occurring is because, well, those acclimated individuals, the ones that live at high altitudes, probably have a high polycythemia, a high red blood cell count, and so maybe that increase in cardiac output isn't necessary to maintain metabolism in O2 at rest. And so this whole lecture brings up a cool topic, which is altitude and training. Some endurance athletes practice altitude training for several weeks before the event. Many boxers are famous for going to sites like Big Bear. Many athletes will train in either Denver or Mexico City to try to get the benefits from altitude. And so, why is that going to benefit you? Well, if you are in altitude, you're going to have that polycythemia, that increase in hemoglobin, that increase in red blood cell count, and so you would be able to carry more oxygen, right? So that gives athletes a competitive advantage. So it used to be, sometimes you hear this phrase thrown around where, coaches will say, train high, sleep low, or sleep low, train high. And so there's many different theories of why someone, would want to train at altitude, or why someone wouldn't want to train at altitude, and what is best. So if you're an aerobic athlete and you are trying, to increase that oxygen binding capacity, but at the same time, you need to be pushing your training and make sure that, okay, every single workout, you're pushing yourself to the limit. Well, it may be recommended that more of a train low, sleep high is recommended. And the reason for this is that, okay, yes, at altitude, you get that polycythemia and that increase in red blood cell count, but your VO2 max at altitude is going to drop. And so you can't work as hard at altitude, right, with lower oxygen than you can at sea level when there's plenty more oxygen. So that's going to limit your performance. And so it's recommended that train low, and so you're able to put yourself to your maximum intensity, or whatever intensity that is, a higher intensity during your workout, so you get more benefits there. And then you sleep high in order to get the benefits of that increased red blood cell production. But, let's say maybe you are more of a track athlete. And, so when you go into that altitude, what's going to happen is, since that there's not as much oxygen, you rely more on your anaerobic metabolism. And so if you are a sprinter, track and field athlete, or someone that relies on a lot of anaerobic pathways during your sport, you may have advantages to training at higher altitude. And so that's really a cool connection there when it comes to exercise and altitude. Some other potential things that occur when you go into higher altitudes is that there may be more of a prevalence of sleep disorders. One example is called Cheyenne-Stokes breathing, which is deep, fast breathing, followed by a stop in breathing called sleep apnea. This could be potentially dangerous, and because of the fact now you're at altitude and then you're having this occurring, it could be potentially dangerous. Another thing that occurs is increased myoglobin concentration. So myoglobin is very similar to hemoglobin, except that it only holds on to one oxygen molecule, and so it just holds oxygen at the site of the muscle tissues. And so since you're going into an environment where there is lower oxygen, one of the pathways, in addition to increasing the hemoglobin content, you increase the myoglobin content. And then there could be other issues that occur, like acute mountain sickness or chronic mountain sickness, where people have headaches, trouble sleeping, nausea, things like that. And so that may last a couple days or maybe for the entire time. Pregnant women especially have to be careful at higher altitudes. And then there also may be evidence or there may be edema or swelling either in the lungs or in the brain as a result of being at high altitudes, which is not a good thing at all. But that is it. That concludes our lecture for today on altitude. And so, again, during that first video, we talked more about what is the problem with going into higher altitudes. And then once you start reaching higher and higher levels, that partial pressure of oxygen gets lower and lower. And so, our response in order to correct that is to hyperventilate. And so that helps reduce the CO2 and increase the O2. But that comes with other effects, such as the respiratory alkalosis. But then again, our body combats that and with the compensated respiratory alkalosis by getting rid of more bicarbonate. So people, of course, are able to live at these high altitudes, but there are a lot of physiological changes that are occurring. Thank you guys so much, and I'll see you next lecture.